Hey, Pussnet, new little video. This one, I want to apologize first before I started. Recently, my channel should be more the mountain ham than the mountain RN. But it's just there's been a lot of activity with field day and stuff, so there was a little bit more radio when I started soda, so that's why I did the video. But I want to continue the video on medical, so I'm trying to catch up. And this one will complete the abdominal portion. And the next one, I hope I'll do it on tests. So labs that we could do, portables, and people could identify and stuff. Because a lot of, as you'll see, a lot of things with, especially abdominal pain, there's a lot of question that could be answered in the algorithm by some simple tests that could be purchased. Obviously, in the medical world, we use a lot of CAT scan, X-rays, blood tests, and things like that. A lot of those are not accessible right now, but there's some of them that could at least help you. So, for example, a urine analysis, so just a little dip can help you with that. Also calls, which I'll talk a little bit later, that could help you as well with differentials of other tests. So let's start. So as you see, it's male abdominal pain. There's just going to be a few that are specific, and so like I was for those that followed the series, when I did the female one, it was kind of separated into gynecologists, so everything that has kind of a reproductive part or pregnant, and actually kind of three parts. So the reproductive parts, all issues that can happen only to female. Then you have also all the issues that can happen with pregnant women, so that's kind of almost another topic on its own. And then you have the typical lady with just non-pregnant but non-eater with their reproductive system, but can have the same issue that men can have. And so we'll touch a little bit more on those one at the not so male issue one, which more like the generalized group. And we'll see just a few of the male. And again, I'm trying when I research those things to talk about things that are relevant or things that could be helped or could be seen. I mean, you have, like, for example, in the abdomen, you have gastroenterology, a whole specialty of internal medicine that specializes just on the digestive tract of system and things. So it can be a very complex system. Surgeon, I mean, if you start having internal medicine versus surgery, there's general surgery that will see some people, other people, for example, pancreatitis and stuff, will be more treated with internal medicine. So I try to generalize as much as I can, and also find things that you could do. And again, staying with things that are like, I don't think on the YouTube I can teach people how to do an appendectomy, not that I even know how to do one either, and I don't think it would be relevant as well. So by doing this, just keep that in mind. There's way more issues, doing your own research as well, but I'm just trying to point out a few things that could at least help you, and things that you could carry in a first aid kit. The first one, constipation. We kind of talk about that. I did kind of a special with a recipe, the Mayo Clinic, and enema. But constipation may be a big issue, especially with in a disaster where people will rely a lot on things like MRE or dehydrated foods. When I went to Aconcagua, and I was like for 2 weeks up in the mountain eating that kind of stuff, I got some severe I got some issue with that, because there was like a lot of not a lot of fibers and things. So constipation will be a very big issue, and it's one thing that I don't hear many people talk. And so this is why when I talk about the enema, I wanted to talk. But and it can be actually even in kids, when I saw a few more of case like this, at a certain age, kids will feel that they don't have any more control over their life, and so what they do is they try to control what they have, and having a bowel movement is one of them. And so what they'll do is they'll hold on of the of their bowel movement. They'll literally kind of almost hold, not go, and then they get constipated to a point that they get so much constipated that they push on their bladder, and then basically they cannot pee. So I saw one kid like this, and that's what it was. And as soon as we give enema, then he was able to pee and stuff, and he can. But yeah, it was a whole thing. So constipation can be very serious. We see a lot of patients in the hospital for that, mostly because of opioids, so because they're on painkillers and things like that. So when you think about bowel movements, there's basically three things that happen. First, your stool has to be well hydrated. So that's why you have to have a lot of fluid. And when I say well hydrated, I mean you can drink tons of water, but if it doesn't get to your stomach, or if it stays too long in your stomach and the water evaporate from the stools, then your stool gets very hard. So your stool has to be very watery. Well, not watery, but they have to be well hydrated. Too much will bring you diarrhea. Not enough will bring you constipation. So first, hydration. So again, if you dehydrated and you don't drink enough water, your stool will probably be an issue. The second is how fast they move. So in our stomach, we have basically what we call peristalsis, and it's basically when you listen with a stethoscope, you'll hear your stomach do that. Well, that movement is basically your stomach kind of pushing, and this is kind of the movement that the belly is trying to do to push those stools down. So at that issue, there's two things that can happen. Either the stools are so dry because they stayed in the stomach for so long because they were not moved, and this is why, for example, the people that are on opioids or taking a lot of painkillers, what happened is that it slowed down the peristalsis, and then the stool stays there, and this is where the water, so at the column, that's where the water kind of comes out over a stool. And what happened is that the stool gets so hard that it becomes this big ball, and it's a little bit like an accident on a highway. It creates a back load, and everything comes back up. So that big ball, now you have to do two things. First, you have, because rehydrating it is impossible almost. We'll see with another way that you can do it. So the other way that you can do it is that now you have this big ball that is not moving as soft because the constriction doesn't work, or the constriction is compromised. You can either increase the constriction, and this is how a lot of laxative works. This is why they give you cramp. It's because it puts your guts into steroids. Like they're gonna constrict a lot. Or we can basically slide it down. So if you have this hard thing kind of sliding down, in some laxatives, that's how they work. They work like oil. Why do I talk about all this? Is because with this in hand, this is how you can approach constipation. So enemas are not always so for example, people like, oh, I'll take an enema and that's it. The thing with enema, so if I have a big bowl of stool here and I put an enema right here, I'll put the water and this will come down, but the top is still constipated. So sometimes you have to have an approach from the bottom and an approach from the top, because you have to push whatever is left is, because even if I take this big ball out, the rest is still, depending on how long you were constipated, but the rest was dust. So that's why enema most of the time works, because it's just one big ball, it didn't work. But I mean, I'm getting sometime in the hospital people that have been constipated for literally weeks, like even sometime like a month. So when you have a month of bowel movement inside your stomach, an enema won't work, because all they will do is move this part, but you have to move the top part. So sometimes we have to give other medications. So this is when you have to choose your laxative. But constipation is best prevented than treated, and it's very easy. Just having, for example, if you're going to eat a lot of MRE and things, a simple solution would be to carry olive oil. And so if you drink, if you had, for example, to your soups or things like that, a little bit of olive oil, it will, even if the ball gets pretty hard, it will help slide it down, basically, almost like being slippery. The second one will be to add fibers. The problem with fibers is you have to be, it's a double-edged solution. On one end, it helps because it creates this peristalsis and it moves the stool. But as well, fiber attracts water. So if you don't drink enough water, and for example, if you ever read on Metamucil or something, that's what they'll tell you. If you read on the bottle, they say drink a lot of water during the day, because what is going to happen is that if the fiber goes there and it takes all the water and there's not enough water, you're going to create actually a bigger constipation and a net. So if you're going to use the fiber route, you have to drink a lot of water with that. So if your supply of water doesn't work well, that's why olive oil would probably, because it's easier to carry, especially in a survival situation. But the Metamucil can help, but if you don't have enough water to supplement with this, then it's not a good option, because it may actually worsen your situation. And then you have, for prevention too, making sure that you're doing exercise, that you're moving your belly, and also there's movement that you can do. So if you go and you kind of massage your belly and create that movement, and basically how you go is you go from the right side lower, kind of bring up with your hand, and then kind of down, up, and then you're following this kind of almost like a square, going from the right lower corner of your abdomen and then from the top. So if you work a lot on the prevention, then and you maintain almost like a stool, and we'll talk, maybe one day I'll talk a little bit about the stools when I do my next one on assessment, because stool is because we have to produce it, and there's some information in there, but if you can keep an eye on it, it's called a Brixton's chart, and I'll put the links down. It's basically, depending on the shape of your stool, it gives you an idea of what's happening and stuff. So if you're starting to see that you're going towards a constipation, drink more water, apply more of that stuff, and you could prevent the constipation. The next one, and this is actually, I almost see it like 2 or 3 times a week, especially in male. It happens more in male because of the prostate, and as you can see a little bit on this picture, the prostate is right over here. And so what happened is that when the male has enlarged prostate, the